کردی واسه من با همه، مثل اینه که میمردم مثل تو. توی نگاهت یه حس غریبی میگفت که دارم میشم عاشق تو. عمر منی آخه عمر منی، چجوری بگم میمیرم مثل تو. توی چشام که نگاه بکنی میبینی که دارم میشم عاشق تو.
Hello, my name is Marilyn Polly and I'm a fourth year health management student. This video which you are about to see is part of a unit in the health management course for fourth year students. One of the learning outcomes in the unit is to develop a project proposal. In this video, you will see fourth year students executing a demographic health survey in Baitata village, which is located at the north coast of Madang. But firstly, what is project management?
The health management here for students in the final year, the first semester, they offered the course project planning and design. The main purpose of the course project planning and design is to give students an insight into how to achieve strategic plans. The national healthcare system has in place very well structured or designed strategic plans, but over the years, it has been identified that those strategic plans, the objectives within the strategic plans are not achieved due to lack of capacity in terms of operational planning and planning of projects. So here at the Health Management Department, we offer the course Project Planning and Design. This course, the main objective of the course is to impart to students knowledge and skills on how to plan and design simple healthcare projects, those projects that can be implemented at the community level, at the health facility level or district, even at the provincial level to achieve the objectives of national health plans. And this year, the students, as part of the project planning and design unit, they were assigned an activity to design a project plan for a community in Madang, and this involved the students traveling to a community, doing initial situation analysis of the people in that area, and then coming up with the foundations of a project plan. Every project plan is based on the principles and the concepts of objective-oriented planning. Like the Papua New Guinea the strategic planning system, it is based on the logical framework approach, or LFA. The LFA, the logical framework approach, the point of departure of the planning process is identification of a problem. So the students, they need a situation analysis of a community here in Madang, and they identified whatever problems that the community were facing that was hindering the access to basic goods and services such as health, education, agricultural services, infrastructural development. So the students, what they did was they designed a demographical health survey which they carried out in Baitata village. The demographical health survey, it involved a surveying of households through a number of questions that were put into a questionnaire which they carried out over a period of 3 days. It involved interviewing the heads of households, identifying the land area, the capacity, also identifying needs of women and children in the village. After the survey, all those data that were collected were analyzed to establish the healthcare needs of the people in that area, as well as the educational needs and other basic needs for public goods and services. It is based on that the students will design a project for the people of Baitata.
Baitata village is located along the North Coast Highway of Madang. It takes about 45 minutes to reach Baitata from Madang town. There are approximately 814 people living in 240 households. Almost everyone in the village lives off the land and its family resides on the appointed land area. Before the students could ever begin the data collection process, they met with the villagers to discuss the idea behind the data collection and to identify the key outcomes of the survey. 2 weeks later, they traveled from Divine Word University to Baitata. They visited approximately 240 households and interviewed 815 members of 27 clans. Some of the key components of the survey were water and sanitation, women and child health, education status, food security, household economical status, health, and gender. From the initial analysis, identified areas of needs were gender equity, adult literacy, primary health care, income generation, enabling environment through infrastructure, and marketing opportunities.
Information we now all the one what matini kamblong interview mipla long sin down blom bla government service kamo sewanem housing service kamo sewanem school service kamo sewanem o mipla kata awanem kan we mipla ok lokisim mani blong halbim sin down blom bla long school fee go long market or buy salt sugar karasin halbim sin down blom bla also matin we kam long interview mipla lokisim long information long making we LLG provincial na national by looks away through long community kisim one album inside lo time me blacks 34 years lo independence kamanta.
For example, during the survey it was established that one of the roles, the main roles of women and children in the area was to fetch water for the family every morning and in the evening. Also due to the geographical area that the people were living in, they were living in mountainous terrains that, which results in the women and children going downhill for at least 100 meters to fetch water and then climbing uphill again before doing the other normal daily chores for the household. This has impacted on the female students not being able to go to school, which resulted in a very low female literacy in that area. And we also know that with a low female literacy level in the area, it will affect maternal health in the area. This has resulted in an increase in maternal mortality in the area over the last few years. All these were established during the survey that the students conducted. After this household survey, all the data that has been gathered are used in justification of a project for the people of the area. The students are then assigned a project plan to complete. They have to identify a need that they will justify using all the findings from the survey, and they will write up a project plan to be submitted to an organization that could fund to assist the people in the area. It is a community engagement approach from the university of teaching and learning, research, and community engagement. The whole survey looks at achieving the research mission of this university. The involvement of the community looks at achieving the community engagement mission of this university. So, as a department of the Waianae University, what we set out to do in an academic year, we set out to achieve our objectives as outlined in our mission of teaching and learning. We also seek to achieve our mission of research as a university and to contribute to generation of knowledge. And we seek towards using our knowledge to assist communities in their daily activities and livelihoods. So that's the main reason why we have these activities built into the assessment of a student, not just to improve the education level or to upskill a student, but to contribute to other areas of research and community development here in Madang.
The most important thing I've learned from project planning and design is where there are issues and problems such as malaria, increase in malaria and all that, there is always an underlying causes or problem to it. So project planning and design clearly showed or identified ways to come up with finding solutions to that problem.
I think this unit has helped me a lot. I mean, especially in designing the questionnaires, formulating them on how to collect data, and to come up and plan or design a project.
To me, like, the project planning was really helpful because I see that once as a health manager, when we get there, we get the real basic data, not the secondary data. It's a primary data that we collected, and we experienced how the people they live in that place. We saw the nature of the environment, the place, the people themselves, the house, everything we see. And when we come up with a project, we have an experience and we put ourselves into their shoes and we come up with a project that will really suit them.
And one of the very important things that I discovered, or I came to realize, was the difference between the primary data or the information and the secondary. Like most of the time we used to do our research or the write-ups based on the secondary informations that are written by other authors or the writers, like those resources or books in the library and from the television or newspapers, all that. But the one that we did in Baitata, it's a primary information, which I came to realize it's very important, as it is what really happens in the area of the society.
I've realized that when writing proposals, it is not an easy job. We have to get primary data and we have to do research ourselves or surveys ourselves in order to write a good proposal. So what I'm intending to do now is that I've learned a lot from this unit and I'm trying to carry out the same thing we did here into my village, because I know that most rural areas, even though proposals are written, but as I've said earlier, they are based on secondary data. So this project, this unit has helped me a lot to write a better proposal, and when it comes to the terms of funding, I know that this unit has helped me to get funding.
The Bachelor in Health Management program, which is provided, it's offered to students here at Divine Word University, aims to prepare or to develop students with the scientific knowledge about health services management, but also management generally, so that by the time they go out, they are able to practice as the innovative critical thinkers, as well as professional health managers, guided by the the management principles, values that they have learned in the course. The course also prepares the students to be to challenge situations as they go out there and to be more innovative than what they are now. But most importantly is for them to be able to use the limited resources that is available to them in whatever organizations that they would be employed or they would be engaged, to use those limited resources to the best of their ability, but to produce good results and to give added value to that organization, to make a difference in a way the organization is doing what they're doing for the people.
So there you have it. Health management students learning the elements of project management and helping Divine Word University foster links between surrounding communities. So, if you're interested to take up health management, contact Divine Word University through the registrar's office and apply. That is all from me, and you have a good day.